Polycystic Ovary Syndrome, PCOS, is a hormonal imbalance that affects the ovaries, the female reproductive organs that produce eggs. It's a common condition affecting around 1 in 10 women of childbearing age. To understand how PCOS affects women, it's helpful to first explore how a healthy woman's body normally produces eggs. This amazing process is like clockwork. Every month, a woman's body undergoes a finely tuned process to prepare for potential pregnancy. This process is regulated by a complex interplay of hormones produced by the pituitary gland in the brain and the ovaries. The cycle begins when the pituitary gland releases follicle-stimulating hormone, FSH, which stimulates a group of immature eggs inside tiny sacs called follicles within the ovaries. These follicles begin to nurture the eggs as they mature. Under FSH's influence, one follicle, the dominant follicle, takes center stage and continues to grow, while the others typically stop developing and disappear. As the dominant follicle matures, it produces estrogen. Estrogen plays a crucial role by thickening the lining of the uterus or womb in preparation for a possible fertilized egg. Around mid-cycle, a surge of luteinizing hormone, LH, from the pituitary gland triggers ovulation. This surge prompts the dominant follicle to burst open, releasing a mature egg ready for fertilization by sperm. Following ovulation, the empty follicle transforms into a structure called the corpus luteum. This structure produces progesterone, another key hormone. Progesterone helps maintain the thickened uterine lining if pregnancy occurs. If there's no fertilization, the corpus luteum breaks down, progesterone levels drop, and the thickened lining sheds, resulting in a menstrual period. This signals the beginning of a new cycle and the start of egg production once again. Now, in women with PCOS, a hormonal imbalance disrupts this carefully balanced process. Excess androgen hormones can interfere with the normal function of FSH and LH, making it difficult for a single dominant follicle to emerge. Instead of one champion, multiple follicles might start growing but fail to fully mature, leading to the development of cysts in the ovaries. This disruption in the hormonal cycle can lead to irregular or absent ovulation, explaining the irregular periods commonly experienced by women with PCOS. Additionally, unpredictable levels of estrogen and progesterone due to the disrupted process can further impact the uterine lining, contributing to menstrual irregularities. In essence, PCOS disrupts the delicate hormonal dance needed for regular egg production and ovulation, potentially making it harder for women to get pregnant naturally. Signs to watch out for. Several key signs can indicate PCOS. The most noticeable symptom is often irregular periods. This can manifest as infrequent periods, heavy bleeding, or even skipping them altogether. Another sign is excess androgen. Androgen is a male hormone that females naturally have in small amounts. However, in women with PCOS, there might be an abundance of these hormones. This excess can lead to a range of physical symptoms, including acne. You may also experience excessive facial or body hair growth in areas like the face, chest, or abdomen. Another sign is male pattern baldness, thinning hair. This high androgen levels can also cause weight gain and difficulty losing weight. This is a frustrating symptom for many women with PCOS as the hormonal imbalance can affect insulin sensitivity, making it harder to manage weight. Finally, as mentioned earlier, PCOS can disrupt ovulation, the process of releasing an egg from the ovary. This can make it more difficult for women with PCOS to conceive naturally. If you're experiencing any of these symptoms, it's important to see a doctor. Causes of PCOS. The exact cause of PCOS is unknown, but it is likely a combination of several factors. 1. Genetics. A family history of PCOS can increase your risk. If your mother, sister, or another close relative has PCOS, you might be more likely to develop it as well. 2. Insulin resistance. Insulin is a hormone produced by the pancreas that helps regulate blood sugar levels. In women with PCOS, the body might struggle to use insulin effectively, leading to a condition known as insulin resistance. As a result, the pancreas produces more insulin to compensate. High levels of insulin can lead to increased production of androgens, male hormones, which can interfere with the ovary's ability to ovulate properly and contribute to other symptoms of PCOS. 3. Inflammation. Low-grade inflammation has been found in women with PCOS. This inflammation may stimulate the ovaries to produce androgens, which can lead to some of the symptoms associated with PCOS. Chronic inflammation is also linked to higher levels of insulin resistance. Diagnosis of PCOS. Diagnosing PCOS involves a multifaceted approach, as there is no single definitive test for the condition. Here are some common diagnostic methods your doctor might use. 1. Pelvic exam. During a pelvic exam, your doctor will manually check your reproductive organs for any abnormalities, such as enlarged ovaries or the presence of cysts. While this exam can provide important clues, it is often combined with other diagnostic tools for a more comprehensive assessment. 2. Blood tests. Blood tests are essential in diagnosing PCOS as the doctor will measure levels of various hormones including androgens, follicle-stimulating hormone FSH and luteinizing hormone LH. Elevated androgen levels can indicate PCOS. Additionally, blood tests can assess insulin sensitivity as many women with PCOS have insulin resistance which can contribute to the condition's symptoms. 3. Ultrasound. An ultrasound is a non-invasive imaging technique used to visualize the ovaries and check for the presence of multiple cysts, which are often seen in PCOS. The ultrasound can also assess the thickness of the endometrium, lining of the uterus, which can be affected by irregular menstrual cycles. A transvaginal ultrasound is among the best ones for clear visualization. In some cases, doctors might also evaluate other aspects of your health to rule out conditions that can mimic PCOS, such as thyroid disorders or hyperprolactinemia, high levels of the hormone prolactin. Treatment for PCOS. While there's no cure for PCOS, the good news is there are effective ways to manage it and improve your overall health and well-being. Once diagnosed, PCOS can be managed through various strategies tailored to your specific symptoms and health goals. These may include lifestyle changes like diet and exercise to improve insulin sensitivity, medications to regulate menstrual cycles and reduce androgen levels, and fertility treatments if you are trying to conceive. While PCOS itself isn't a direct cause of illness, it can raise your risk for certain health conditions down the line. Insulin resistance, a common feature of PCOS, can increase your chances of developing type 2 diabetes and heart disease. The hormonal imbalances associated with PCOS can also contribute to anxiety and depression. If you're planning a family, it's important to know that PCOS can make it more difficult to get pregnant naturally due to irregular ovulation. There are also some potential links between PCOS and sleep apnea, fatty liver disease, and a slightly increased risk of endometrial cancer, although the overall risk for cancer remains low. However, the key takeaway here is that these are just increased risks, not guarantees. Working closely with your doctor through regular checkups can significantly reduce these risks and help you stay on top of your overall health with PCOS. Thanks for watching. Please like, share and subscribe.